were very deliberate in picking this particular segment of topics to target for these webinars, because there's a lot of conversation happening on the macroeconomic side of things. We just didn't feel enough was being done where it's most needed. And I think as Africa, the one most common thing across all of us is things like informal settlements, rural areas, the challenges of public transport. And so we thought we'd put together some of our thoughts and some of the people working in this space to showcase what's happening so we can all learn. In terms of AVPA and who we are, we're a Pan-African network of social investors, and we bring together the whole continuum of investors. And when you talk about continuum, is looking at people who are investing for impact, expecting either no returns or market returns. So this includes everyone from philanthropists to impact investors, debt and equity providers. Our mission is to increase the flow of capital into African social investment. So basically, how do we grow social impact in Africa? And if you look at why this is important, is that our traditional sources of capital for social investments in Africa that were in the past, things like aid and government funding are facing huge challenges and are dwindling. We think aid might even reduce further post-COVID as more people look to invest money internally in the West. And our governments are going to be a lot more broke than ever before. And why we started this response is we asked ourselves when the COVID outbreak came about, what can we do? And the first thing we thought of is we can bring together communities of response. And we set up some platforms in our 3 regional offices in Kenya, Nigeria, and South Africa. And those have grown exponentially. I mean, we have over 300 people now working in the platforms. And through this process, we figured out one of the things we could also do is help moving information around as quickly as possible, and especially showcasing solutions. And this is why these webinars were set up. So thank you for joining us. Looking forward to having a really good session with the speaker that we've got. I think it's pretty exciting. Please note that this will be running every Thursday, and we'll also be very deliberately bringing in speakers from the different countries in Africa so we can learn from each other. Otherwise, have a nice webinar. Thank you.
Thank you, Frank. And now I'll hand it over to Nancy to make a few also remarks before we get started with the speakers.
My mic was off. Thank you so much. Welcome everybody to this webinar series. We're excited. We had, I think, over 150 people register for this. So we know already that this is much needed across the continent. As Frank said, we'll be doing this every Thursday, and we'd like to hear from all of you in terms of what would you like to hear? Who would you like to hear from? What topics do you want us to focus on as we move forward? I'd like now to go to our first poll. We'd like to do a temperature check on those who are on the call today, just to find out who, out of all those on the call today, what are you doing around COVID? Have you started any COVID initiatives? So Margaret, if you can put up the first, yeah, there it is. Has your organization started any initiatives in response to COVID-19? Just give us your response there, and then we'll look at the results. If you haven't yet, that's fine. We know that a lot of people are still struggling to find out, you know, to really identify what they can do as individual organizations. So any responses yet, Margaret?
Yeah, yes, there's people are responding.
Can you put
just give them like one more minute and then we can close it.
Okay. I think we have people from across the continent and even from Europe and the US. I saw on our registration we have some people from Europe and the US. So it would be interesting to know how many people have actually started COVID-19 responses.
The responses are still coming in. So far, we're at 58 people.
All right.
So those are around 80% who have already voted.
Wonderful. Okay, maybe we can put up what you have so far so that we move on to the on the program. Okay. So not yet, but we are planning. If you need any help in terms of connecting with other people, we have a few initiatives that might help you as you're planning on how to respond. I'm glad to see that there's so many 80% who have actually started various initiatives. That's great. Okay, let's move on. I'd like now to introduce our first speaker, Jay Larson, and followed by Maureen Mora, both of them from Tunapanda Institute. Jay and Maureen are working on digitizing curriculum and training programs for youth around COVID-19. And Maureen will talk to us about, she currently lives in Kibera, and so she'll be giving us a firsthand understanding of the kind of challenges and the kind of initiatives that she's seen in Kibera. Over to you, Jay. Thank you very much. Margaret, you can put down the poll now, results.
And actually, maybe Jay, before you get started, I'll just make a quick couple of housekeeping remarks. So for folks, if you have questions for the speakers, please put them in the group chat. If you look at the bottom of your Zoom screen, there should be a chat box, the option for a chat box. So please do put them there. We will sort of reserve the questions for the end. So we've saved about 25 minutes at the end of this session just for question and answer. Also, please, you'll see a reactions button at the bottom of your screen. You can applaud, you can give a thumbs up. So if you agree to what any of our speakers are saying, please do feel free to use the reactions and the chat. And if you are having any technical issues, please feel free to sort of direct message my colleague George, who will help to sort you out in the case of any video or connection challenges. All right, perfect. Over to you, Jay.
Hi, everyone. Thanks so much for the introduction, and thanks for putting this together, and thanks for everyone who's taking the time to arrive. My name is Jay Larson. I've been here in Nairobi for about 7 years, and this issue, I think, is extremely important to everyone around the world, not just in the context of COVID. But if we look at global population growth, I think most people here know that sub-Saharan Africa is going to be one of the largest growing populations in the next few decades. By 2050, it's estimated that 40% of the world's children will be here. Simultaneously, it's a very non-urbanized continent at the moment. A relatively small percentage of people live in cities. It's very rural still. That's going to change very quickly at the same time as population grows. So estimates of at least twice as many, up to 4 times as many people will be living in cities. And when they come to cities, they're coming not to necessarily flee a rural hardship, although there are difficulties living in rural areas. They're looking for a better life. They're looking for a way to work harder, to meet other people, to be exposed to new ideas. And when they pass into cities like Nairobi, like Lagos, like Accra, a lot of them will pass through informal settlements. And so this is why, looking around the world of what to focus my life's work on, I focused on access to opportunities that help people get into the digital economy, to be creators, to have a voice for their own communities. And so I moved into Kibera, into the outskirts of Kibera about 6 years ago. And I lived there for 4 years, right in the outskirts next to the first training program that we set up. We teach broadly technology, design, and business skills. And we support our learning with video content, as well as other interactive content. And where Maureen, she graduated of our very first cohort more than 5 years ago, and we've been working together ever since. And so the thesis that we came in with is that there's a lot of creativity a lot of passion, a lot of intelligence in these places. And that given the right tools and the right ability to collaborate and the right skills, these places are not just something that needs aid or needs money. These are people who can create value and take part in the world. And I think having worked with Maureen and many other young people, we've seen that this is definitely true. And so I think my one message here, I mean, you know, we are working on some interactive content that can help people learn. More importantly, the content's going to help people come together and teach each other. It's not just about sitting in front of a computer. And that's really important. In low-income areas, people store a lot of their value in their social networks. And people don't want to just sit on a computer screen or sit on their own. They need to be constantly interacting. So as we think of these learning activities, we also need to think about building networks. And that is if there is any lockdown, internet, as I think DJ noted here, internet will be extremely important. And so we are creating these tools, but we're also empowering the young people who work on our team. And apart from me and my brother, all of the team members at Tuna Pond are graduates of our training program. They come from these types of areas, and they're parts of that community. And so we're going to be creating content, but also engaging our team and our graduates in teaching each other within the area. And I think, you know, that we want to be taking an approach of involving people in the global economy and connecting people to opportunity. And that was true before COVID, it's true during COVID, and it will be true afterwards. But, you know, Maureen and I together experienced a small riot in Kibera about 3 or 4 years ago, politically motivated, where some of our team got caught in a building. And we've seen firsthand what happens when people lose hope and when people feel like they don't have an opportunity. Things do get violent, police do come in, tear gas does get thrown around. And so I think our little thing is helping people feel connected with the hope that people feel like they can contribute and take part in the global economy. I think that's pretty much it for me. I've written on the topic of this in Professor Batangi and Demo's book, Digital Kenya, and I'm happy to chat about this more, but I think Maureen has a lot more interesting things to say than I do. So thanks, everyone. Over to you, Maureen.
Thank you, Jay. So maybe we can move on to the next slide. As we're doing that, let me just give like a brief introduction of who I am. So my name is Maureen Mora, and I've been working with Tuna Panda Institute for 5 years or so right now. I joined them as a trainee back in 2014. I went through the training program, and right now I'm in the management roles of the organization. So for today's webinar, I'm just going to talk about the life of living in Kibera, especially during this pandemic and lockdown. There are a couple of awesome things that are happening on ground here in Kibera. But then again, at the same time, it is not reaching out to very many people. So I don't know if most of us know Kibera and the stories related to Kibera. It's not all that bad, but I can say the media is not doing like full justice to the positive side of the slums. And maybe go to the next slide. The next one again. Yes. So one of the things that we are currently doing is, as Tuna Panda Institute, is trying to create content to about COVID-19 and just create awareness. And the reason why we're doing that, most of the people who live in low-income areas, especially Kibera, they do not have access to necessary materials and resources to have this information. Because most of this information is online, like you go to social media, for example, Twitter, among other platforms, they do not have access to that. So there is information in Kibera at the moment about COVID-19, but it's not reaching out to everybody, especially people who are in the slums down there completely. And one of the things we're currently is we are currently trying to digitize our content and add on to the COVID-19 information out there. And the other thing is our training program used to be like one-on-one, but Jay mentioned, we are trying to help and ensure that it goes online so that the people who live in Kibera can have access to that content. And one of the ways we're trying to ensure that they'll have access despite them not having the necessary materials and resources is we're working on one project known as TunapandaNet, which is a community network that is meant to connect different institutions, churches, schools, and also people who live in that area so that they can have access to this information. So on this other hand, we're creating content. On the other hand, we're trying to find the necessary materials and resources to connect them. The other piece that I think I should also mention is we have NGOs in Kibera that are currently also distributing food to the different people, especially the elderly. The government has tried, but the last time the government was here to distribute food, there was issues. A couple of people got injured, the food was not enough, because the people who are distributing ended up taking most of the food as well. Another organization that I think is also doing really great is Shofco. They are providing water and have set up different wash stations in different areas in Kibera so that people, as they're walking by, they're washing hands and also sanitizing. And we also have another organization known as Somo Africa that is distributing Somo care packages to the elderly people. And what do I mean? They give food, general food materials like flour, oil, sugar, among other things for them to take them for like a month. So there are things people are doing, but it's not reaching everybody within the slums. So there are a couple of things that I just like to point out before I finish off is there is distribution of food for elderly people and other people, but it's not enough or sufficient at the moment. In terms of education, most of the schools in Kibera right now, they're closed down. Students cannot be able to study at home because they do not have access to these resources like internet or smartphones so that they can go online and study. And then in terms of health, Shofco is trying, but it's not enough yet. So I think that's what I had to share for today's webinar. Feel free to reach out if you have any questions or ideas on how we can improve how we live here in Kibera. And yeah, so thank you very much.
Wonderful. Thank you so much, Maureen. And thank you to everyone who's submitting questions. I've seen some really, really excellent questions come in, and we'll get to those towards the end. I think we're going to go to another poll, Nancy, right now, if you want to lead that one off, and Margaret, if you want to push that out.
Yes. Margaret, could you put up the next poll question, please? Okay, what's the one thing your organization needs right now to scale your COVID-19 intervention? Since 80% of you said you've already started COVID-19 interventions, we'd like to know where you think the gaps are, whether it's lack of you need connection to distribution networks, as we heard from Maureen. Shofka and other organizations are trying to distribute food, water, soap, etc., but maybe they need distribution networks. Maybe it's volunteers, funds, link to a government agency. Please just fill it out where you feel that
So Margaret, how are we doing on the poll? You're on mute, Margaret.
Sorry. We're doing great. So far, we're at 56% people are voting. We give them like 1 more minute.
Maybe we'll give them another 15 seconds or so. So if you haven't yet put in your response, please do so now. And then Margaret will publish the responses for us to see.
Sorry, my internet crashed for a second there. So Margaret, can we see the results, please?
Okay.
Okay. Funds looks like the highest at 38%, and distribution of distribution network, sorry. Links to government agencies. Interesting that food, although Maureen says that that's one of the main issues, it doesn't seem to highlight, it doesn't seem to be so high on this agenda. So funds are definitely at the top of the list for everybody. Okay, let's move on. I want to introduce our next speaker. Thank you very much, by the way, Jay and Maureen. We appreciate that. Our next speaker is Andrew Waititu. He's the CEO of Safe Hands Kenya. Andrew, over to you.
Thanks very much, Nancy. Hope everybody can hear me clearly. So maybe what I'll start by doing is just giving an overview of what Safe Hands Kenya is, because this is not your traditional organization. This is a coalition of different companies that came together just about 3 weeks ago and have already started having a little bit of an impact specifically in the informal settlements. So maybe if you go to the next slide, it'll give you an idea of the companies that made up this coalition. And I think it's important to note that this says 6th of April. This has changed since. We have more partners who have come on board. And just to give you an idea of how this partnership kind of came together, basically, a lot of these companies are not the size of some of the larger corporates that you find in Kenya, and felt that if they came together, they could do a lot more to try and impact, what's happening specifically in the informal settlements, but then being able to grow beyond that to address literally the whole country. So what the companies came on board to do was to address WASH issues, so issues of sanitation, and we'll get to that on the next slide. But the key things, no, just go back one slide, sorry. The key thing that the coalition partners needed to commit to was the suspension of the profit motive if there were services that were going to be utilized from them that were paid for. Speed to get to market, and last mile saturation, which in a case like addressing issues in the informal settlement is very important, because you don't want to have to go to, say, for example, a school or a chief's office and dump a whole bunch of products and cause some of the chaos that we have seen happening in the last few days. So moving on to the next slide. What Safe Hands was addressing is a large-scale distribution of soap, hand sanitizer, and surface disinfectants. We have since added masks onto that. But in essence, it was to look at the three major pillars of WASH. So sanitation products, sewage extraction, and water supply. And the first thing that we were able to do pretty quickly was address the availability of products. So the partners that are involved in this coalition, one of the things that makes them quite unique is that, number one, they have presence in literally all areas of the country, including the informal settlements. We're able to map out what areas they are present in. We're able to overlay that with data around population density, and then try and ensure that we're able to have enough product that is able to saturate each particular area in a very structured way, and report back not only to our donors, but also to government in terms of how impactful we are. Additionally, this we have also put together a behavioral change campaign, which you may have seen on the first slide, which speaks about, we being the cure. So it's based on the premise that there is no cure to COVID right now. We have to be the cure. We have to change our behavior, either through, you know, where we go, how we wash our hands, staying away from touching people, and literally just reducing exposure of people around us to the possibility of catching something from us if we have the disease. So if we move to the next slide. So on the consumer behavior part, I did touch a little bit on this. We're looking at access, ensuring that every Kenyan, particularly those in hard to reach areas, have access to the product. A communication campaign on education on behavioral change. So for this, we are working with different partners, including people like Shujaz that do the comic strip, Village Creative that created the visual and other media campaign that you probably have been seeing in the newspapers. And then we also have a user experience team that is looking at the actual products and how they are landing in each different space. So for example, we will not just take your standard you know, hand sanitizer that will be available in the shop, but try and see how can we work with the local community to provide a hand sanitizer, maybe wall mounted, that makes it easy for everybody to have access to. It could be at shops, it could be at eating houses, it could be in high transit areas for people like matatu stops. And literally designed from the bottom up, something that can quickly be put in place and utilized. And then what we do is ensure that that station is filled with sanitizer every day. So moving to the next slide. Some of the challenges and learnings, I think obviously this is uncharted waters for many people, and we are working in a landscape where regulation is changing literally on a weekly basis. So things like the partial lockdown that we have seen, ensuring that we are able to get our products across some of the borders that have now been set up. We can't move in and out of Nairobi easily. Ensuring that our people are able to work within the curfew hours and get back home safely. Last weekend, there was a regulation on food and material donations. So ensuring that our people are able to continue to operate. How do we continue to engage with government to ensure that happens? Obviously, with the kind of scale that we are trying to do this at, a lot of products must be brought in. If you look at sanitizer, things like ethanol, some of the gelling agents, we don't have enough of this available in the country, obviously because of the demand that this situation has put on the systems that are already in place. So how can we reach out to where these materials are available, involve government to help reduce some of the costs, importation costs, duties, taxes, tariffs, to be able to bring this so that each dollar that we are spending on these materials ensures that we have more of these products available to the people. So ensuring some of the learnings, ensuring that we have an open channel of engagement with government, and keeping them abreast of what it is that we are doing. The fact that we are not a traditional organization approaching things in the traditional way has meant that we have to spend a lot of time in educating different partners, including government, of what we are doing. And then another one is the power of networks. A lot of these organizations may not be as big as I mentioned, some of the other big corporates, local corporates that we have here, but they have networks of people at a global level. And all the work that we have been able to do to date really has been on the back of philanthropic grants that we are getting at outside Kenya. We are in the process of setting up a local way to collect money, and that will probably then also accelerate our ability to do much more. Next slide. What we need, I think this goes without saying, because we are a medium to long-term solution. Yes, we have been created because of COVID and the challenge that COVID brings, but in truth, at the moment, we have more Kenyans, especially in the informal settlements, impacted by sanitation-related diseases or conditions. Things like diarrhea currently kill more people in a week than we have had in the whole of Kenya die from COVID. And so we see ourselves as learning from this to be able to put in place a behavioral change that will positively impact literally the entire country, hopefully, if we're able to scale fast enough and keep the funding going beyond COVID. So that is basically who we are. Thank you. The last slide basically talks about the kind of branding that we are putting behind this coalition, which is, I basically says in Swahili, I am the cure. We are the cure. That's the hashtag that we are using for this. So thanks very much. I look forward to your questions.
Excellent. Thank you so much, Andrew. Yeah, go ahead, Nancy. We have some really good conversations going in the chat. Maybe I'll just pick out a couple, Nancy, if that's okay. There's been quite a debate going around whether distributing food or distributing food vouchers or M-Pesa would be more effective for informal settlements. There was quite a couple of folks in the chat who are asking, you know, is it food that's the way to go, or food vouchers, or just giving money? I don't know, Maureen, Jay, and Andrew, if anyone sort of wants to respond to that.
So maybe I could give it a bit of a go. This is something that has come up within the coalition in terms of distribution of food. As you know, as you may see, some of our coalition members are actually involved in that already. But we felt that, you know, some of these systems are already in place. And although that is not our mandate right now, we have been involved in conversations with some of the people setting up these response mechanisms. And the thinking was that it would be easier if you create a kind of e-voucher system that would allow people to cash in on different items and use the existing infrastructure. Let them buy their food where they know and from whom they trust. So use maybe a mobile money platform to provide this e-voucher system, and which also allows them to buy things that may be beyond food that they still need on a daily or weekly basis.
Maureen, any thoughts on that?
Yes. So if I may speak on behalf of most people here in Kibera, is I would say I'd go with cash, because here in Kibera, M-Pesa does work. So I'd say there's both cash and M-Pesa, because most of the people here, they buy most of their goods from Kibera, within Kibera, and the level of exposure to some of these technologies is not very high for most of these people here in Kibera. So it means if you send a food voucher to them, they might not know how to use it or where to go and use it. And the other piece is, if it's donating food into Kibera, it needs to be done in a way that is very organized, so that there will be no chaos or fights or fooding gets done before it has reached 20 more people. And one of the ways we can actually do that, because I've seen a chat there, is partnering with organizations that are already doing that. That's number one. Or identifying local institutions that already have access to the internal parts of Kibera and working with them do that kind of distribution. So I'd just say go with cash or M-Pesa, but vouchers, it will be pretty hard.
If I can add to what Maureen said, thank you, Maureen. If I can add to what Maureen said, there was a problem. First of all, let's remember that on this platform, when we talk about M-Pesa or you know, some of us, even when we talk about Kibera, we have people on this platform today that don't necessarily know what we're talking about. So please explain yourself. So M-Pesa is the mobile app that allows us to move money around in Kenya, and it's widely used. But I do know that last week there was some issue around people buying things with M-Pesa and then reversing that transaction. So a lot of people are asking for cash, straight up cash, because they feel like they can't trust M-Pesa right now through, you know, in this COVID era. But I had there's somebody else here who's also asking, is Safe Hands working with others, not just to deal with sewage extraction, but the safe handling and transfer of bodies of the deceased? We haven't had high numbers of deaths yet in Kenya, but maybe this is something we need to start thinking about. And Andrew, maybe you could respond to that question, or if you know somebody who is thinking about that right now.
So the short answer is no. And you know, back to your point, luckily, touch wood, we haven't had as many deaths in Kenya as they have in other countries impacted by COVID. And all the deaths have primarily been in you know, institutions where these people are under treatment. So the hospitals and the rest, so they're able to manage that. As Safe Hands, the coalition of companies, we are not healthcare practitioners, so we would not be placed to be able to deal with that. And hence, we were very kind of deliberate around what our mandate is and managing what we can. So Safe Hands is really looking at the wash aspect, and even the issue of distributing masks created a lot of debate within the coalition, but we felt, again, it's something that we probably can do as an add-on service. But as many of you know, the whole issue of masks has been a very heated one around reusable masks, single disposal, where do they go after that, and all that. So it's still stuff that we are dealing with.
Great, thank you. Maureen, somebody's asking, can you give us a little bit more context on, as I mentioned, not everybody knows when we say Kibera, they don't know what we're talking about. Kibera is an informal settlement here in Nairobi, and somebody's asking, you know, how many people live in Kibera, and what are the what kind of housing do people have, or how many people are living in per house? On average, how many people live in one house?
Thank you very much. So Kibera is one of the largest, or I think the second largest slum in Africa at the moment. And it's a very congested place. And in terms of the number of people living in a household, I'm not sure about the figures at the moment, but I can check on that and try to send it out. But the last time I looked at the data in terms of the number of people per household, it was roughly between 5 people, a minimum of 5 people in the household. Most of them are elderly people, and it cuts across elderly and the youth also at the same time. And for the number of people in Kibera, I'm not sure about the figures at the moment. It's something I can just look it up, then get back to you on that.
Great, thank you. There's also a discussion around verification. When donors are giving funds, we've seen that, you know, most people on the call today are talking about have mentioned that it's funds that are needed. But how do they verify that these funds have gone to the right places? And especially if it's like cash transfer or food distribution. The other question is, how do you identify the most needy in some of these informal settlements? Because as we saw recently, only a week ago, there was a stampede for food. People were hurt. I think even one person died. And some of the people who were actually distributing the food, as Maureen said, were stealing the food at the same time. So those are 2 questions. Maybe whoever wants to attempt to answer that, please do.
I can try with the first one. So the question is, how do you verify that things have been done as they said they would be or been sent to where they get sent? And this is an extremely interesting and important question. You're fundamentally asking, how do you create trust in a low trust environment? People aren't used to institutions being trustworthy. They're not always used to it being advantageous for them to tell the complete truth, because there's a lot of people taking advantage of all sorts of other people. This is not a judgment on any people, for the record. It's the institutions and the situation we find ourselves in. And it's very difficult. You find that the institutions that are better at getting money are often the people who can tell the better stories. There's fraud that comes up. A lot of people start with good intentions, but overpromise and then underdeliver. And, you know, historically, this has been solved with effectively rule of law and trustworthy court systems. People create agreements, they create ways of tracking them, and they follow through. And there isn't a totally complete answer to this. I think for cash transfers, you can solve it quite easily because everyone's SIM card is connected to their ID. And people might have multiple SIM cards, but those should all be connected to the same ID number. So in theory, you could get the numbers of people, get rid of any duplicates. You could ask the telcos who's in a specific area, and then you could literally just send them cash that way. And then at least you know that the cash got to a specific place. I spend a lot of time thinking about how do you create trust and how do you make sure people are following up on commitments? How do you get small actions to aggregate into bigger things? I'm happy to talk about that more offline. I'll send my email. But I think it's a very big, tough question. And that straight delivering cash is one of the easiest ways, given the penetration of M-Pesa, where you at least know that cash went to a specific person, and you have a pretty good idea that you're not sending cash to the same person multiple times.
So maybe I can touch a little bit on the other aspect, which is in the case of Safe Hands Kenya, where we are trying to raise money and get product out. One of the first things that we had to do was get on board a partner who would try and keep us honest. So PwC is a financial and accounting partner, so doing everything from project cost management. So some of our partners are providing us services at cost. So PwC would do audits of that to ensure that we are getting bang for the buck, so to speak. So that way we are able to go back to our donors and say, yeah, this is what we used your money for, to be able to try and get X amount of product in front of X amount of people. The other aspect, which I've just touched on, which is around how do you ensure that things around this coalition, as mentioned, is the use of data and feedback, a way to kind of feedback. So you'll not see any huge donations happening from Safe Hands Kenya, in a big, I don't know, chief's office or a school where we tell people just come and collect stuff. In some of the things that we have piloted last week, we were in Kibera, we're actually doing door-to-door handovers of soap and surface disinfectant to the different families. So that way we are able to then provide feedback again of where this product has gone. So there's different ways to do this. Some of it is slow. We are learning as we go ahead. But hopefully we can then create a blueprint that can be used in future emergencies beyond COVID.
Great, thank you. Maureen, there's a question for you. Somebody's asking, you mentioned M-Pesa is unreliable at the moment. Why exactly is that the case?
So I will not fully say it's fully unreliable. I think there's one person who mentioned there that most people, like after a transaction has occurred, somebody reverses it back. So that is just one incident that I can talk about. But I would not fully say it's unreliable. I'm just saying will need to ensure that once a transaction happens, nobody will reverse it back. So that means the other party doesn't get what they deserved to get. And if we are going to use, yeah, I'll just say that for the moment, just being keen on when transactions happen and when they actually do not happen, because most people have multiple SIMs registered with multiple different names. So today I might call with a number that is registered to Maureen. Tomorrow it's registered with my second name. The next day it's registered with my third name. So you might not end up knowing who is who from these three people. Yeah.
And then somebody had asked about how many people live in Kibera, and one of our participants answered and said anywhere between 500,000 to 800,000 residents, but the figure changes because a lot of the people move around. So yeah, there's the answer for that. I saw another question here about
Nancy, I think it's also,
about testing.
it's also important to kind of put that number in context. I believe that number, that 500,000 number, live in about 3 square kilometers. So it's not a big area.
Yes, it's a very small area, and even the rooms are very small. When Maureen talks about 5 to 6 people living in a house together, these are very small areas, very, very small accommodation. There's also a question about testing and whether we can use the current HIV/AIDS testing infrastructure to test for COVID-19, and if at all, do we have data on how many people within, let's say, Kibera have tested positive? Do we know if there are any cases?
At the moment, there have been no cases that have been identified in Kibera, but I heard there's a rumor going around that the health system or department was to come into Kibera and test most of the Kiberians. So I'm just waiting to see if that actually happens or it was just a rumor. But till date, we've not had any cases in Kibera, but a testing will be done soon if the rumors are true in this case.
The government has actually announced that they're soon going to start mass testing. We haven't had that in Kenya yet, so maybe that's why you heard some of those rumors. There's also a question about how to build trust with community leaders and how to sustain it, especially when we don't know how long this situation will last. Are churches being used, or church leaders being used? How do you build trust in communities like Kibera?
So one of the ways you can actually build trust with communities in Kibera is, at the moment, I would say the different youth, women centers and institutions that have been operating in Kibera for long, and they have been engaging and involving the community people in the different projects they are working on. The other way is also just working with non-profit organization or community-based organizations that have been operating in Kibera in a long period of time. And what I've seen with most of the people in Kibera is, if you engage and involve them in the different activities either your organization or institutions are doing, they tend to accept and feel that they have some sense of ownership. And when most of the people in Kibera feel some sense of ownership, they would want to ensure that that initiative is still there and it's actually doing good than bad to the community. But if you don't involve them, they tend to fight back and not in a good way. And there was actually an incident.
Yeah, they tend to be very suspicious.
Yeah.
Sorry, I cut you short. There was an incident?
Actually, there was an incident where like an organization was employing people outside Kibera and not employing people who are in Kibera. And some of the youth actually just went to that place and were like, we need you to employ our youth who have actually gone to school than going outside Kibera and bringing in people and not supporting people who are from here. And that was just a message that they were sending, that we have people who are educated. Why not give them opportunities so that they can improve their own livelihoods than going outside and leaving the people who are from here? So one of the ways doing that.
Thank you very much. It looks like we've come to the end of our session. We're almost at the end of the session. I wanted to ask one last question to all our participants today, because we want to do these kind of webinars on a weekly basis every Thursday. So I'd like to find out from you who you'd like to hear from, if there are particular people you'd like us to invite as speakers, and what topics you'd like us to talk about. It seems that one of the main topics might be around funding.
I think we lost Nancy there for a second. So I think what Nancy was going to close with was to say, these sessions are geared to help Africa learn from Africans learn from each other and move around solutions that especially affects the most vulnerable as quickly as possible amongst African countries. And we're starting with Kenya, Nigeria, and South Africa as our initial centers, but actually we're very open to listening to interesting solutions from other African countries. So you please know of interesting solutions that are being applied in informal settlements, rural areas, looking at places like applications in crowded public transport and those kind of things. Would be very happy to engage with you. And don't get limited to programs, technology, or communication pieces that are doing some innovative stuff or impactful work. In terms of getting involved, there's a slide that you're able to see now that talks about various ways you can get involved. There are existing platforms in Kenya, Nigeria, and South Africa, and the existing working groups. And it also includes the organizations that were featured today, covered by the guest speakers, Tunapanda and Safe Hands. All these are opportunities for people to plug into, should you wish to get involved. And there are email addresses there for Rachel and Nancy. Please send them an email, let them know of your interest, and we'll make sure we connect you to the right people. But otherwise, appreciate your time. Is there any other slide, George, beyond this one? Yes, so here are just some final details of people. And once again, it's a real pleasure to have you hosted on these. As mentioned, these will be held every Thursday. We'll make them very dynamic, we'll make them very topical, very interesting. And due to the nature of the COVID-19 response and the pandemic, things are going to be changing on a weekly basis. And we're going to try and make sure that we, as much as possible, are able to bring you relevant information to help you do what you're doing better on the front end, and help you better understand this condition, protect yourself and protect your communities, and hopefully we can all crash the curve. Otherwise, apart from that, thank you. Oriel, any closing remarks from your side?
Thank you so much, Frank and Nancy, and thank you once again, Maureen, Jay, Andrew. Really insightful conversations. I will leave the chat and the meeting open for a few more minutes. So please do, for those of you who are adding your suggestions for these topics, please do keep putting them in. We're going to have a sit down and sort of plan out what the next few sessions are. So if you have topics, if you have speakers that you would like to recommend, just feel free to please go ahead and keep populating them in the chat, and we can go through that in detail later. So we'll leave that up for now, but thank you everyone for your time, and really appreciate you spending your morning or afternoon or wherever you are with us. So thank you all very much for joining, and we look forward to seeing everyone next week at the same time.